Welcome back once again to Wisdom is Power. This time I'm addressing medical students, and we'll be looking at the 10 commandments that is of medicine that they do not teach you in medical school, but I think it's important that medical students and FY1 interns are aware of. The first one we'll look at is treat others not as you want to be treated, but as they want to be treated. We've all heard of the golden rule, and it says treat others as you would want yourself to be treated. However, in medicine, people want to be treated in a certain way, and it may not always be the way we want to be treated. And this is the first point to bear in mind. Number 2, never assume anything in medicine, except that you assume that no one knows anything. Never assume anything with regard to examination of patients, history taking, investigations, because assumptions can be quite dangerous. I've had experience in the past, so many experiences actually, where I've seen people assume things and they were not correct, and patients became very unwell. Number 3, always double check what others have done, including yourself. So this may be double checking if you put a cannula in, for example, if it's done properly. I remember one time I put a cannula in and hadn't left the tourniquet on, but I came back to check and it was there. So simple things like that, or it might be double checking investigations that you've done, double checking if you've ordered a particular test, or even sometimes examination findings. Number 4, always keep a backup of all your documentation. And this might include if you've done particular history taking, or it may be that you have done a training and you got a certificate for it. I remember one example where I actually had done a training, however, I had kept it safely in my emails backed up, but I got a response from one of the trainees that I have not done this particular training course, and I could have gotten in trouble. However, I produced a document for them and they could say nothing. So always back up your documentation. Number 5, always be meticulous in documentation and in seeing your patients. I can't emphasize this point more, in that pay attention to details. The simplest things, always listen to your patients in particular, and make sure and document everything. Every conversation that is said with patients, with their relatives, because you never know when this documentation might save your career. I've had many experiences where documentations that were clearly made has helped me out and prevented problems. So meticulous documentation is important. Number 6, never erase emails others send to you. You never know when it will be useful. So as previously mentioned, I had saved that email certificate, but other emails that people may send to you, you never know when you can use this in the future, when it's needed because of certain circumstances or situations that you find yourself in. It may be with colleagues, for example, where they have said that you have not done something when you actually had done it, and it's recorded in the emails, because people tend to forget. But if it's on the emails, it's a hard document, it's there, then you are protecting yourself. Number 7, always put the patient's interest first. But this means you taking care of yourself. Remember, a tired or unwell doctor is a dangerous doctor. So you need to take the time to rest, right? Yes, you want to get the jobs done, but it's kind of pointless and dangerous if you are not thinking clearly. You may miss something that might be vital to save the patient. I recall one example of someone who actually was so stressed out in a night shift that they missed a patient having severe hypoglycemia, and that patient eventually did not do quite well with that result. So it's important to always get your rest because it will be better for the patient. Number 8, we cannot be replaced by artificial intelligence because medicine is as much an art as a science. So, of course, there's a lot of hype about artificial intelligence, but what these people fail to realize, is computer sciences and others, is that medicine is not just numbers, it's not just algorithms. There's much more to medicine than that. It's about pattern recognition, it's about nuances that computers and artificial intelligence cannot see. Maybe in the future, they may be able to recognize some of the patterns. However, experience is very important. And medicine is actually not just something that you learn from the book. Remember that if you want to learn to swim, you need to actually go into the water and actually swim. Similar with medicine, it's sort of like a trade, just like plumbing or gardening or what have you. Farming, it is a trade, and it's passed on from experienced doctors to inexperienced ones. Number 9, never show your anger or irritation to anyone, even though they may deserve it. Remember, you are supposed to be perceived as the best of humanity. So even though you may be right in your intention of anger, be calm and be careful, because you are the best of humanity. And finally, number 10, medicine is the noblest of all professions, in my opinion. For we are a teacher, a confidant, a healer, a scientist, a carer, a leader, a detective, and much, much more. So if you as a medical student have chosen this career, that's great. Just remember the responsibility that comes with it. So I hope you have benefited from these 10 points that they do not teach you in medical school.